16 Days of Activism is a global campaign where organizations, activists, individuals all come together to raise their voice against the various forms of violence being perpetrated against women, girls, and gender diverse people who are at the various intersections of marginalization. Gender-based violence is a grave violation of human rights which has serious implications on the health, well-being, safety and security of all of these people who are vulnerable to these various forms of violence.
So to join this campaign, my colleague Richa and I, Vatsala, would like to emphasize that it is really important for all of us to come together and resist these larger systems that are reproducing patriarchy and its various forms of oppression. And while we do that, we must not forget that it is very important to strengthen the support systems available for survivors. And one way we can do this is by recognizing gender-based violence as a public health concern. By recognizing gender-based violence as a public health concern, we are putting the needs of the survivors at the forefront and also calling the role of the healthcare providers in providing care, treatment, and also a first-line support for these survivors. By doing this, we are ensuring that gender-based violence is not merely located within the criminal legal system.
We also want to emphasize that gender-based violence has serious implications on the sexual and reproductive health rights of all individuals, which also includes young people. Young people face challenges and vulnerabilities not just in terms of restriction to their mobility, but also in terms of expression of their own identity and selves. So our call is that in our efforts to address gender-based violence, we also need to keep all of these intersections and vulnerabilities in our mind in order to provide affirmative care and support to everyone.